Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Schaefer. This is Valley Health Minutes. We've all heard about concussions. The CDC estimates that about 3.8 million concussions happen in the United States every year, sports-related, recreation-related. So what exactly should you be watching for? And how serious can this be? We're talking with Dr. Scott Davis about this today, and we're so glad you're with us. Explain to us what exactly a concussion is.
Yes, so a concussion is a impact to the head or the brain that creates what we say when we're talking to our colleagues is a metabolic injury. And so the brain tissue becomes injured or irritable is the way I like to explain it to my patients. And you develop a wide array of different neurologic symptoms that can be associated with that neurologic brain injury. And irritability is the best way to think about it.
What are some of these what symptoms can you watch for in your child if you have a child that plays sports? I know so many parents are worried about this and the possible lasting effects of it. But what would signal that there might be a concussion involved?
Yeah, that's a tough question to answer because there is a wide array of symptoms, and sometimes there may not be any symptoms for a while and they show up later. So it can be, it sounds pretty straightforward to recognize head trauma and then look for symptoms of an injury, but it can be quite difficult. But the most common symptoms to look for are headache, sensitivity to light or sound, emotional lability. So a child or adolescent after a concussion can sometimes become excessively emotional or cry at inappropriate times after the injury. But headache, vision changes, light sensitivity, dizziness seem to be the most common that we deal with initially. And then as things progress, or if it was a more severe injury, then of course other neurologic symptoms that we think about are nausea and vomiting, even convulsing or posturing with the muscles, tremors, and those indicate a more significant injury.
Yeah, that's frightening to even think about.
Yeah.
So a standard protocol, if you see some kind of impact, should your child automatically be checked?
The rule of thumb in young children and adolescents, we want to be overly cautious in checking. So if there's any sort of an impact, especially in our youth population, we want to pull them from play and have an evaluation quickly, just because they are more sensitive and their symptoms may vary a little different than a full-aged adult. And as you graduate up the levels to high school, middle school and high school, the same. Like we have an extra layer of caution that you may not, people watch concussions on TV and in the NFL and college level, and the approach sometimes needs to be even a little bit more cautious in our youth population. So absolutely it should be pulled and evaluated if there's any question of a concussion in the pediatric age.
So if they feel like a concussion is a possibility, what kind of medical management is needed? What steps do you take?
Well, in the acute phase when it happens, the most important part is being pulled from play at that time, and then as quickly as possible assessed for the degree of the concussion to come up with an accurate diagnosis, and then a follow-up plan from there. So treatments for acute concussion, we get questions a lot from parents that first night after the injury, what should we do? And it actually is okay for your child to sleep after the injury.
Okay, that's good, because you always feel like you've heard, don't let them sleep.
Exactly. So sleep is important to help the brain heal. So especially that first night after the injury, they will be allowed to sleep, and they can take medication, Tylenol or ibuprofen. Can be important to help relieve some of those initial symptoms, because it is a miserable feeling having a headache and the dizziness. So that's an important step that we get asked about a lot. Yeah.
So then what does a follow-up look like?
So the initial follow-up should be done as soon as possible after the injury if you can get with your primary care provider. There's also, at times of these injuries, it's usually after hours, so there's evening hour clinics that are available and walk-in clinics on the weekends. So you want to utilize that to start the process. And then getting to your primary care provider as soon as possible for a thorough evaluation, neurologic exam to determine the degree of the concussion, mild, moderate, or severe, and then a follow-up plan can start from there.
All right, Dr. Davis, thank you so much. There's a lot of athletes out there, and a concussion is a possibility that it, could be part of their athletic experience. So thank you for all the tips and tricks. We appreciate it. Thanks for being here for Valley Health Minutes. I'll see you next Monday.